Welcome to G Fun Facts Online. In our hyper-connected world, a pathogen in a remote village can traverse the globe in mere hours. This reality demands a vigilant, expert guardian of public health. For decades, one name has stood out in this global arena: the United States Centers for Disease Control and Prevention, or the CDC. While its main job is protecting American lives, the CDC learned long ago that when it comes to infectious diseases, borders are just lines on a map. To keep Americans safe, it has to be deeply involved in improving public health everywhere. Today, we're diving deep into the story of the CDC, exploring how a small domestic agency grew into a global health giant, what it actually does, the battles it has fought, and the challenges it faces in its mission to create a safer, healthier world for all of us. Let's get started. The CDC's journey began not on the world stage, but in the American South. Established on July 1, 1946, it grew out of an office created to combat malaria around military bases during World War II. By 1951, they had successfully eliminated malaria as a major public health problem in the U.S., and the agency's mission began to expand. Its first steps into the international sphere were often reactive. During the Asian flu pandemic in the 1950s, the CDC helped distribute testing supplies globally. But a major turning point came in 1958. The CDC dispatched a team of its elite disease detectives, officers from the Epidemic Intelligence Service, or EIS, to Southeast Asia to help with smallpox and cholera outbreaks. This was its first major technical support mission abroad. The 1960s saw the CDC take on an even bigger global role. It absorbed programs for tuberculosis and venereal disease, and in 1967, it integrated the Foreign Quarantine Service, a clear signal of the growing importance of international disease surveillance. This was also the decade the CDC joined one of the most ambitious public health campaigns in history: the global eradication of smallpox. Starting in 1966, the CDC's efforts in Central and West Africa were crucial. They applied a strategy of intense surveillance and containment, finding cases and vaccinating everyone around them. This scientific approach, in partnership with the World Health Organization, led to the declaration of global smallpox eradication in 1980. It remains one of humanity's greatest achievements. As new diseases emerged, the CDC was on the front lines. In 1976, its disease detectives flew to Zaire and Sudan to investigate terrifying hemorrhagic fever outbreaks. Their work led to the identification of a new pathogen, the Ebola virus. Then came the 1980s and a new global pandemic. In 1981, a CDC publication printed the first scientific report on a mysterious new illness that would later be known as HIV/AIDS. This was the start of a decades-long war against the virus, which would later be formalized through massive initiatives like the President's Emergency Plan for AIDS Relief, or PEPFAR. Throughout this time, the CDC was building the programs that would become the pillars of its global work. In 1980, it established the Field Epidemiology Training Program, or FETP, in Thailand. This program trains local health professionals to become disease detectives in their own countries, creating a global network of skilled responders. Today, FETPs exist in over 75 countries. The dawn of the 21st century, especially after the 2003 SARS outbreak, brought a laser focus on global health security. This led to the creation of the Global Disease Detection Program and, in 2010, the establishment of the Center for Global Health, unifying all of the CDC's international efforts. From fighting malaria in Georgia to fighting pandemics across the globe, the CDC's history is a testament to one core principle: protecting health at home requires improving health everywhere. So, how does the CDC actually do this? Its global strategy is built on a set of core functions. Like a public health toolkit, designed to help countries build strong, resilient health systems. First is data and surveillance, the eyes on the enemy. You can't fight what you can't see. The CDC helps countries build systems to collect, analyze, and use high-quality data. This gives them a real-time picture of disease patterns, allowing for early warnings of potential outbreaks. For example, CDC support for measles surveillance in Guinea and Liberia led to targeted immunization campaigns that stopped the virus from spreading. A key strategy here is the 717 approach. Detect a potential outbreak within 7 days, notify authorities within 1 day, and launch an effective response within 7 days. The second pillar is laboratory systems, the foundation of diagnosis. Accurate and timely diagnosis is the backbone of any disease control effort. The CDC works to build sustainable public health labs that can quickly and accurately identify pathogens. This means training lab staff, improving diagnostic tools, and ensuring dangerous pathogens are handled safely. The fascinating part is how these investments create a ripple effect. Lab capabilities built through funding for HIV and tuberculosis programs proved to be invaluable during the COVID-19 pandemic, as countries could pivot this existing infrastructure to test for the new virus. The third pillar is workforce and institutions, the human element. In a crisis, the most valuable asset is people who know what to do. The CDC's flagship program for this is the Field Epidemiology Training Program, the Disease Detective Academy we mentioned earlier. FETP graduates are the frontline responders in their own countries, and they have played crucial roles in countless outbreaks, from Ebola to COVID-19. The CDC also helps establish national public health institutes, which act as a central hub for a country's public health activities. The fourth pillar is prevention and response. This covers everything, from supporting routine vaccination programs to ensuring countries have emergency operations centers ready to manage a crisis. Since 2005, CDC experts have helped investigate nearly 6,000 outbreaks in 67 countries, training local rapid response teams along the way. Fifth is innovation and research. The CDC works to understand the why behind outbreaks, who gets sick, where, and why, and to develop new tools. This could be evaluating a new malaria vaccine, or figuring out the most effective way to deliver health messages in a specific cultural context. Finally, there's policy, communications, and diplomacy. Science is useless if it isn't translated into action. The CDC works to provide policymakers with the evidence they need to make smart decisions. And during a crisis, clear communication is essential to prevent panic and guide the public. The CDC's reputation allows it to engage in health diplomacy, building relationships that promote evidence-based public health. The CDC channels these functions through several massive, flagship global health programs. Let's look at the big ones. First is PEPFAR, the U.S. President's Emergency Plan for AIDS Relief. Since 2003, this has been a cornerstone of U.S. global health, and the CDC is a key partner. Working in over 46 countries, the CDC provides the scientific and public health expertise for the HIV/AIDS response. This includes scaling up testing and treatment, preventing mother-to-child transmission, and strengthening the lab and data systems that make it all possible. This infrastructure has become a platform for addressing many other health threats. Next is the President's Malaria Initiative, or PMI, launched in 2005. Led by USAID with the CDC as a key implementing partner, PMI aims to control and eliminate malaria. The CDC provides the scientific muscle, monitoring the effectiveness of interventions, tracking insecticide resistance in mosquitoes, and conducting research on new tools to fight the disease. The Global Polio Eradication Initiative is another monumental effort. The world is on the very brink of eradicating polio, and the CDC has been a key scientific leader since the initiative launched in 1988. The CDC supports surveillance to detect any trace of the virus, runs labs to confirm diagnoses, and helps plan vaccination campaigns. Its STOP program, Stop Transmission of Polio, has deployed thousands of public health experts to support these efforts on the ground. Finally, there's the Global Health Security Agenda, or GHSA. Launched in 2014, GHSA is a global effort to help countries build their own core public health capacities to prevent, detect, and respond to infectious disease threats. The CDC is a lead implementer for the U.S., working directly with ministries of health to strengthen their surveillance systems, labs, and emergency response management. The goal is to stop outbreaks at their source before they can become pandemics. Of course, the CDC's work is most visible when it's on the front lines of a major outbreak. The 2014 to 2016 Ebola outbreak in West Africa was the largest in history, and the CDC deployed hundreds of staff to Guinea, Liberia, and Sierra Leone. They provided critical support in every aspect of the response, from contact tracing and lab diagnostics to setting up emergency operations centers to coordinate the massive effort. The COVID-19 pandemic was the ultimate test. The CDC was at the center of the global response, tracking the virus, developing tests, and providing guidance. Its long-standing global partnerships were crucial for supporting the response worldwide. However, the agency's response also faced significant criticism. Many argued it was too slow initially, fumbled the rollout of diagnostic tests, and that its public guidance was sometimes unclear. The pandemic exposed both the immense strengths and the bureaucratic weaknesses of the agency. More recently, outbreaks of mpox and Marburg virus disease have highlighted the value of the CDC's long-term investments. When mpox surged in the Democratic Republic of Congo, the lab and surveillance systems built with CDC support over years enabled a faster response. When Rwanda reported its first-ever case of the deadly Marburg virus in 2024, the country was able to leverage the public health workforce and systems built up through years of partnership on its HIV program. This demonstrates how sustained investment in one area can pay dividends when another crisis strikes. But this work is far from easy. The CDC faces significant challenges. Its global health programs depend on congressional funding, which can be unpredictable and subject to political shifts. Budget cuts can undermine years of progress. The agency has also faced criticism for becoming too bureaucratic, with internal processes that can slow down its response time in a fast-moving crisis. And in recent years, political interference has threatened to undermine the agency's scientific independence and has eroded public trust. Looking to the future, the CDC is focused on adapting to these challenges. A key part of its vision is a renewed focus on health equity, ensuring that its work reaches the most vulnerable populations. The agency is also working to modernize public health data systems, making them faster and more connected. And, of course, it is committed to strengthening global pandemic preparedness, building on the lessons learned from COVID-19. The goal is to create a world where every country has the capacity to handle its own health threats, making the entire world safer. From its humble origins fighting a single disease, the CDC has evolved into a global public health powerhouse. Its commitment to science, data, and partnership has saved countless lives. In our deeply interconnected world, the health of Americans is inextricably linked to the health of people everywhere. The work is far from over, but the CDC's mission remains more critical than ever to build a healthier, safer, and more secure world for us all. Thanks for listening to Fun Facts Online.